Hi, my name is Wendy Schmidt, and I am a registered nurse at Gove County Medical Center, and I primarily work in the cardiac rehab department here. So I'm just going to tell you a little bit about cardiac rehab today. It is an outpatient service that is for people who are recovering from different heart problems, primarily heart attacks, stents, angioplasty, open heart surgery, people who've had aortic valves replaced, and some people with congestive heart failure. And we recently also can see people now with peripheral artery disease. So if you have problems with your legs, having pain, then you can come do therapy with us. So I am housed under the physical therapy department, but I am separate on our own as we deal with mostly just the cardiac patients. Cardiac rehab is, we've had it for about 15 years or close to 15 years here at Gove County Medical Center, which we pull patients from lots of different areas because some of the other hospitals do not offer that around here. So we are a program that primarily see people 3 days a week, and we generally go anywhere from 6 weeks or 36 or 6 weeks or 6 sessions to 36 sessions of cardiac rehab. And so basically what we consist of is, I tell people most of the time it's good old-fashioned exercise. However, we are connected to heart rhythm, to the computer, so I can watch people's heart rhythm as they exercise and make sure that they're safely doing what they need to be doing to help their heart get stronger after these heart events. Our goal is primarily to help people get stronger and have more endurance, and then also hopefully maybe even get better in shape than prior to their heart problems. One of the other things that we do is they call it risk factor modification, which is just really a fancy word for helping people make healthier living choices, lifestyle choices with eating better. So we do a lot of diet education, talk about good healthy foods to eat, and we also review cholesterol levels. We keep track of people's medications. We check their blood pressures before and after. So a lot of times I am the intermediary between your doctor and you to kind of figure out if your medications are on track also. And then we do stress factor or stress relieving or coping techniques, I guess is what you would like to say, which is where we discuss just people deal with chronic stress and ways to help decrease that in their lifestyle, because that attributes a lot to heart problems. Another thing we do talk about is to eliminate and to quit smoking or tobacco products, which is another area that is a big risk factor for heart problems. So those are the risk factor modifications we deal with. We do know that cardiac rehab and good exercise can lower your chance of having future heart problems. I have lots of patients who continue to come after they've met their sessions that their insurance pays for, and we kick them into a program we call the wellness program. And that's really a really cool program that's designed for anyone who has any risk factor for heart problems. So they can come in and they can exercise with us. We don't monitor them, but we do check their blood pressures and kind of keep communication with their doctor. And then they have guided exercise through the staff in cardiac rehab, so they know kind of what to do, how far to push themselves, and things like that, which I think a lot of people, especially maybe older people, feel safer doing that. They're able to feel safe when they exercise and also get the same benefit of the exercise. So we call that the wellness phase. So the type of exercise we do in cardiac rehab is aerobic exercise, which is what benefits your heart. And a lot of people say, especially in this area, who are hard workers, manual workers, and farmers, say, I don't need to probably do that therapy after my heart attack because I get enough exercise. Well, research shows that intentional exercise, such as aerobic exercise, helps strengthen your heart the best. So people who go to cardiac rehab really do better and survive longer and have less chances of future heart problems. So that's our goal for them. And so we have 2 treadmills, 2 new steps, and 2 bikes. that we use and utilize in our program. And we also have just light weights, and we do weight training and weight strengthening also to help. Here in a little bit, I'm going to talk to a gentleman who is going to be discussing his experience with cardiac rehab, and we're just going to talk a little bit about what he went through, what he had wrong with his heart, and how he benefited from it. Hi, and we are back here with a cardiac rehab patient of mine that we're going to talk a little bit about today. This is Bill Briggs, and he is a Gove resident that lives south of Gove and Farms, and we're going to ask him a few questions about his experience with heart problems and his experience with cardiac rehab. And he'll say all good things today, right, Bill?
That's right. Nothing bad.
Tell us what happened to you and when you had your heart event.
Okay. Looking back on it, I had symptoms probably for 3 months because it was in the summer and fall of 2010, and I would get tired and just didn't feel like I had a lot of energy. Had kind of a vague fullness in my chest that I went through a lot of Tums. And then one afternoon in the fall, I just driving along, and all of a sudden it was just like an elephant sat down on my chest, and I thought, well, this might not be good. So I went home, and my wife had grandkids in the tub, so she sent my brother-in-law and I up to the hospital here, and we went trotting down the hall. They wondered which one of us was having the heart attack, and I told them I was, and they got me on the table, and within 3 or 4 minutes, I was completely wired up. Dr. Nemechek was there, assuring me that he was sure it was indigestion. And then they took the blood test, and it came back that I was having what they call it, an MI. Mm-hmm. And I asked him, how come? I said, what's an MI? And he said, well, that's a heart attack. I asked him, why don't they call it an HA? And he said, that would be a headache. And so after they did all the testing and they found out that he couldn't get rid of the blockage with a shot, that they put me in the ambulance and got me to Hayes, and I had a stent put in probably about 4 hours after the whole thing began. And then when I came out from the stent, it was just amazing how open I felt. I just felt like my chest felt better than it had in years. I mean, it was just like, so obviously I had some blockage building up, and what had actually happened was I had some plaque break loose at the time of the heart attack, and it completely blocked the main artery, and that's when it happened. But then, I'd had plaque building up, so I had the one stent, and that's been almost 9 years ago.
Okay. So the main artery that you had blocked, they call that the widowmaker, because that is the largest artery that supplies blood to your heart. So that is amazing that you lived through that.
And I never really, I just felt like, okay, I just along for the ride at this point. Mm-hmm. So I never had any feelings like, well, this was going to be it.
Yeah. And a lot of times I think what you said about taking the Tums is people have a lot of symptoms that they attribute to indigestion that in hindsight you can look back and think, oh, that was probably my heart causing pain. Yeah. So how did you get involved in the cardiac rehab program here?
Well, as soon as I got home, then you called and set up an appointment to come up here. And of course, it was in the fall, so that was easy as far as my work schedule was going to be. And obviously I wanted to take care of myself, and so I started with the cardiac rehab program. And what was it, 13 weeks originally, and then after that, for about the first year or year and a half, I tried to be pretty regular about coming up here 2 or 3 times a week to get in shape and everything. And the whole thing was a good conversational place. I mean, it was kind of like the coffee shop without coffee, but we've changed that now.
Now we actually have coffee available to all those interested in cardiac rehab. Yeah.
So anyway, the exercises we do, the 2 of them bore me to death, the push step and the bike. Treadmill I can stay on all day because that's kind of my cell phone pace. And then the weights is what really wears me out, and it still does. Those really challenge me.
Yeah, the weights are a good workout for people. Surprisingly, people say that a lot.
But people have had a heart event, that's really a good program because it gives you the discipline to stick with the program, because it's real easy to fall away from it. If you
Did
don't
you
come
find
up.
it was hard to exercise at home on your own?
Yeah, it's impossible. I mean, I just can't do it. I tried a treadmill in front of TV, and it wasn't any fun.
Yeah.
So it's just a lot better up here,
Yeah.
doing it up here.
Yeah. We try to make it fun in cardiac rehab, and definitely enjoy the social part. And you're around other people, right, that have had heart problems also.
Yeah.
So you kind of get to hear other people's stories and what they are doing to help their health. One of the things you said was your cell phone pace, and I just wanted to bring this up because I think a lot of men have similar issues maybe with, we talk about risk factors in cardiac rehab, and one of those risk factors for you is more stress or type A personality, where you're kind of driven and going all the time, and how to modify that is kind of a hard thing when you're wired that way. And so that's one of the things that we talk about in cardiac rehab. And for you, wouldn't you say exercise has been a good outlet?
Yeah, because
to help that?
I don't ever really feel stressed, but I am pretty anxious. And so I never want to put anything off. I'm always in a hurry to get everything done. And so anyway, it's just a real good way to do it. And the variety of exercises obviously is good too, and you just feel better after you do it.
Yeah, definitely.
I do think a couple of other things that were really important in recovery is your diet. And fortunately, I have a wife who cooks a lot and likes to cook, and she always made, ever since then, we've been a little more careful about what it is. And right afterwards, she was always preparing things that would be really good for my diet. And it'd be hard to do this if you didn't have good food to eat and were having to find your own stuff and eating junk food, or if you were physically unable to do the exercises, then it would be hard to recover. Because if you had bad knees or hips or something and couldn't do the exercises, that would make it a lot more difficult.
So have you given up French fries?
Not completely, and I do limit myself to one Long John Silver trip a year.
Okay.
So anyway, so that's not my first stop anymore.
Yes. And Bill did increase his, we kind of measure someone's damage to their heart in an ejection fraction, which is how much blood your heart's pumping with each beat. And when Bill came to me right after his heart attack, his ejection fraction was down to about 25%. And then within a year or two, his number went up to 60%, which tells us that the exercise, the diet, the stuff he was taking, his medications, dealing with the stress, all those things together really increased your output, which is going to increase your energy and give you a better lifestyle. And so he really is a success patient with cardiac rehab. So
another thing that really improved, I always fought blood pressure ever since the day I got out of the Navy 45 years ago. And I was on a lot of different medications, but the one they put me on after this, and also the cholesterol medicine, I don't know if it worked in combination, but my cholesterol has been real low and blood pressure's been low. But part of that might be the beta blocker, I don't know, on the blood pressure.
Probably all of it together, honestly. And Bill's a good example of someone who has kind of anxiety-driven blood pressure, and then after he exercises, it always drops to be a good normal limit. And so the benefit he gets from his exercise alone in blood pressure is a great thing for him. So. And
I'm a real believer in staying on the medicine, because my pulse rate usually runs in the low 60s. It used to be probably in the 80s before that. So it's I would recommend it to anybody, and it's a lot of fun, and they don't pay Wendy enough.
All right, I did not pay him to say that.
Oh, really? I thought you said that I'd get something for that.
Well, we appreciate you being here, Bill, and we thank you for taking your time out of your busy schedule to share with us your experience. So
okay, thank you very much.
Yep. If you're interested in cardiac rehab and need to find more out about it, just call the hospital and visit with one of us down in the therapy department. Our phone number is 785-754-5167, or you also can visit with your primary doctor. Thank you.